Medical Assistant Exam EKG Review. Question 1. For a patient encounter in a preventive care visit, the assistant is comparing two needle gauges. Which statement is accurate? Option A. A smaller gauge number indicates a larger needle diameter. Option B. All injections use the same gauge. Option C. Gauge has no relation to needle size. Option D. A larger gauge number always means a longer needle. The correct answer is option A. A smaller gauge number indicates a larger needle diameter. Needle gauge numbers are inverse to diameter, so lower numbers are wider. Needle gauge varies by medication, route, and patient factors. Gauge specifically describes needle diameter. Gauge describes diameter, not length. Question 2. Before the visit continues in a certification exam scenario, the patient asks why they must lie still during an electrocardiogram. Which explanation is best? Option A. The machine cannot record any heartbeat unless the patient holds breath for 5 minutes. Option B. The electrodes are used only to deliver medication. Option C. A movement can create artifact that makes the tracing harder to interpret. Option D. A movement changes the patient's blood type. The correct answer is option C. Movement can create artifact that makes the tracing harder to interpret. Stillness improves the quality of the electrical recording. Normal breathing is usually allowed, but excessive movement should be avoided. Electrodes detect electrical activity and do not deliver medication during a standard recording. Movement has no effect on blood type. Question 3. At the start of care in a cardiology practice, a chain of custody urine drug screen is collected. Which practice is most important? Option A. Document each transfer and maintain specimen integrity. Option B. Skip signatures if the specimen looks normal. Option C. Allow the patient to take the specimen home first. Option D. Use an unlabeled container until the lab receives it. The correct answer is option A. Document each transfer and maintain specimen integrity. Chain of custody documents who handled the specimen from collection through testing. Appearance does not replace custody documentation. Uncontrolled possession breaks specimen integrity. Unlabeled specimens can be rejected and cannot be reliably traced. Question 4. As part of exam preparation in a medication administration visit, the P wave is reviewed on an electrocardiogram. Which event does it represent? Option A. Atrial depolarization. Option B. Ventricular depolarization. Option C. Ventricular repolarization. Option D. Kidney filtration. The correct answer is option A. Atrial depolarization. The P wave represents electrical activation of the atria. Ventricular depolarization is represented mainly by the QRS complex. Ventricular repolarization is represented by the T wave. Kidney filtration is unrelated to electrocardiogram waveforms. Question 5. Before the visit continues in an urgent care office, a patient has an irregular pulse during routine vital signs. Which measurement method is most appropriate? Option A. Skip the pulse and record not available. Option B. Count for 10 seconds and multiply by 6. Option C. Use the patient's previous pulse from the chart. Option D. Count the pulse for a full 60 seconds. The correct answer is option D. Count the pulse for a full 60 seconds. An irregular rhythm requires a full minute count to improve accuracy. The findings should be measured and reported rather than skipped. Short counts are less reliable when the rhythm is irregular. Old values do not represent the current clinical status. Question 6. To protect safety in a same-day appointment, a patient reports dizziness when standing and the provider requests orthostatic measurements. Which approach is most appropriate? Option A. Measure blood pressure and pulse in different positions according to protocol. Option B. Record the first seated blood pressure as orthostatic. Option C. Have the patient walk quickly before the measurement. Option D. Measure only oxygen saturation while the patient is seated. The correct answer is option A. Measure blood pressure and pulse in different positions according to protocol. Orthostatic vital signs compare cardiovascular response to position changes. A single seated reading does not show positional change. Exertion can distort the readings and increase fall risk. Oxygen saturation does not assess the blood pressure and pulse changes requested. Question 7. Following office protocol in an outpatient laboratory, lead V1 is being placed for a standard 12-lead electrocardiogram. Which location is correct? Option A, fifth intercostal space at the left midclavicular line. Option B, left arm below the clavicle. Option C, fourth intercostal space at the left sternal border. Option D, a fourth intercostal space at the right sternal border. The correct answer is option D, fourth intercostal space at the right sternal border. V1 belongs at the fourth intercostal space on the right side of the sternum. That location corresponds to V4 in standard placement. The left arm electrode is a limb lead site, not V1. That location corresponds to V2. Question 8. Before the visit continues in a women's health clinic, the term bradycardia appears in the chart. Which meaning should the medical assistant recognize? Option A, inflammation of the liver. Option B, fast breathing. Option C, high blood sugar. Option D, slow heart rate. The correct answer is option D, slow heart rate. The prefix brady means slow, and cardia refers to the heart. Inflammation of the liver is hepatitis. Fast breathing is tachypnea rather than bradycardia. High blood sugar is hyperglycemia. Question 9. A medical assistant is working in a pediatric clinic when a patient from a different cultural background describes a health practice unfamiliar to the assistant. Which response is most appropriate? Option A, refuse to document relevant information. Option B, tell the patient the practice is foolish. Option C, ask respectful questions and avoid judgment. Option D, assume all people from that culture act the same. The correct answer is option C, ask respectful questions and avoid judgment. Culturally sensitive communication explores patient beliefs while maintaining respect. Relevant patient information should be documented according to policy. Judgmental language damages trust and may prevent disclosure. Stereotyping ignores individual differences. Question 10. During a quality control review, a manual blood pressure cuff is too small for the patient's arm. Which result is most likely? Option A, the temperature will be elevated. Option B, the blood pressure may read falsely low. Option C, the pulse oximetry reading will be inaccurate. Option D, the blood pressure may read falsely high. The correct answer is option D, the blood pressure may read falsely high. A cuff that is too small can overestimate blood pressure because pressure is applied over too narrow an area. Cuff size has no direct effect on body temperature. A cuff that is too large is more likely to produce a falsely low reading. Cuff size does not directly determine oxygen saturation accuracy. Question 11. At the start of care in a primary care office, the pancreas is discussed during patient education. Which hormone is associated with blood glucose regulation? Option A, thyroxine. Option B, melatonin. Option C, estrogen. Option D, insulin. The correct answer is option D, insulin. Insulin is produced by pancreatic beta cells and helps regulate blood glucose. Thyroxine is a thyroid hormone involved in metabolism. Melatonin is associated with sleep-wake cycles. Estrogen is a reproductive hormone and is not the main pancreatic glucose hormone. Question 12. In a family practice clinic, the bladder of a blood pressure cuff is not centered over the brachial artery. Which issue may occur? Option A, the patient will automatically faint. Option B, the reading may be inaccurate. Option C, the pulse oximeter will stop working. Option D, the oral temperature will decrease. The correct answer is option B, the reading may be inaccurate. Proper cuff placement over the brachial artery is needed for accurate auscultation. Incorrect cuff placement can be uncomfortable but does not automatically cause syncope. Blood pressure cuff alignment does not control the pulse oximeter. Cuff placement does not change oral temperature. Question 13. Following office protocol in a quality control review, a child needs a height and weight recorded for medication dosing. Which documentation practice is safest? Option A, use the parent's estimate if the scale is nearby. Option B, record height only because weight changes often. Option C, round weight to the nearest 10 pounds. Option D, record the measurements using the unit required by the office protocol. The correct answer is option D, record the measurements using the unit required by the office protocol. Accurate units are essential because dosing and growth assessment can depend on precise measurements. Estimated weight is less reliable than a measured value. Both height and weight may be needed for clinical assessment. Large rounding errors can create unsafe dose calculations. Question 14. For a patient encounter in a busy front office, A patient asks why a medication is placed under the tongue. Which route is being described? Option A, ophthalmic. Option B, topical. Option C, gotic. Option D, sublingual. The correct answer is option D, sublingual. Sublingual administration places medication under the tongue for absorption through oral mucosa. Ophthalmic medications are used in the eye. Topical medications are applied to the skin or surface tissues. Otic medications are placed in the ear. Question 15. As part of exam preparation in a community health clinic, the assistant reviews the normal pacemaker of the heart. Which structure is identified? Option A, sinoatrial node. Option B, gallbladder. Option C, ureter. Option D, alveolus. The correct answer is option A, sinoatrial node. The sinoatrial node normally initiates the heart's electrical impulse. The gallbladder stores bile and is not cardiac conduction tissue. A ureter carries urine from kidney to bladder. An alveolus is a lung air sac. Question 16. To protect safety in a medication administration visit, a tourniquet has been in place for more than 1 minute before venipuncture. Which action is safest? Option A, move it over the venipuncture site. Option B, ignore the time because tourniquets do not affect tests. Option C, release it and allow the arm to recover before continuing. Option D, tighten it further until the vein bulges. The correct answer is option C, release it and allow the arm to recover before continuing. Prolonged tourniquet time can cause hemoconcentration and affect test results. A tourniquet is placed above the site, not over the puncture area. Tourniquet time can affect certain laboratory values. More pressure can increase discomfort and alter specimen quality. Question 17. When a patient encounter unfolds in a telephone triage workflow, a patient states that the listed pharmacy is no longer used. Which action best supports accurate care coordination? Option A, choose the pharmacy closest to the clinic. Option B, update the preferred pharmacy after verifying the new information. Option C, delete all pharmacy information from the record. Option D, leave the old pharmacy because it is already in the chart. The correct answer is option B, update the preferred pharmacy after verifying the new information. Current pharmacy information helps prescriptions and refills reach the correct location. The preferred pharmacy should come from the patient rather than staff convenience. Removing needed information can interrupt prescribing workflows. Outdated demographic information can delay medication access. Question 18. When a patient encounter unfolds in an outpatient laboratory, an intramuscular injection is ordered for an adult. Which site may be used according to protocol? Option A, inside a visible vein. Option B, the fingernail bed. Option C, a reddened rash site. Option D, deltoid muscle when the medication and volume are appropriate. The correct answer is option D, deltoid muscle when the medication and volume are appropriate. The deltoid can be used for certain adult intramuscular injections when volume and medication are suitable. A vein is used for intravenous access, not intramuscular injection. The fingernail bed is not an intramuscular injection site. Irritated or infected skin should generally be avoided. Question 19. During a certification exam scenario, the term hematuria is reported on a laboratory result. Which finding does it indicate? Option A, protein in the stool. Option B, blood in the urine. Option C, air in the lungs. Option D, sugar in the blood. The correct answer is option B, blood in the urine. Hematuria means blood is present in the urine. Protein in stool is not hematuria. Air in the lungs is not described by hematuria. Sugar in the blood is described by glycemia terms. Question 20. An office review in a cardiology practice shows that the medical assistant is measuring respirations after counting the pulse. Which technique helps obtain the most accurate result? Option A, count for 5 seconds and multiply by 12. Option B, record the respiratory rate from the last visit. Option C, count respirations while the patient is unaware of the measurement. Option D, ask the patient to breathe as deeply as possible. The correct answer is option C, count respirations while the patient is unaware of the measurement. Patients may change breathing patterns if they know respirations are being counted. Very short counts are often inaccurate for respirations. Current respirations must be measured during the encounter. Deep breathing changes the normal respiratory rate and effort. Question 21. Before the visit continues in a procedure setup, the assistant identifies an abnormal rhythm on a tracing after it prints. Which action is within the medical assistant role? Option A. Discard the tracing to avoid alarming the patient. Option B. Give the tracing to the provider promptly according to protocol. Option C. Change the tracing to make it look normal. Option D. Diagnose the rhythm for the patient. The correct answer is option B. Give the tracing to the provider promptly according to protocol. The assistant may recognize urgency and route the tracing, but interpretation belongs to qualified clinicians. Abnormal results must not be hidden or discarded. Altering medical records is unethical and unsafe. Medical assistants should not provide a cardiac diagnosis. Question 22. Following office protocol in a primary care office, the term tachypnea appears on an intake form. Which meaning is correct? Option A. Low temperature. Option B. Painful urination. Option C. Slow pulse. Option D. Rapid breathing. The correct answer is option D. Rapid breathing. Tachy means fast, and nea relates to breathing. Low temperature is hypothermia. Painful urination is dysuria. Slow pulse is bradycardia. Question 23. Given the workflow in a quality control review, the assistant removes gloves after contact with blood-contaminated gauze. Which action should follow immediately? Option A. Place the gloves in a regular drawer. Option B. Perform hand hygiene. Option C. Apply lotion instead of cleaning hands. Option D. Use the same gloves to clean the next room. The correct answer is option B. Perform hand hygiene. Hand hygiene after glove removal reduces the chance of transmitting microorganisms from contaminated gloves. Used gloves are contaminated waste and should be discarded properly. Lotion does not replace hand hygiene. Gloves are task-specific and should not be reused between patients or areas. Question 24. As part of exam preparation in a walk-in clinic, a patient wants information released to a spouse. Which documentation is usually needed? Option A. A verbal request from the spouse only. Option B. A note written by the assistant after the fact. Option C. No documentation because spouses always have full access. Option D. A valid authorization or permission according to office policy. The correct answer is option D. A valid authorization or permission according to office policy. Disclosure to another person should follow privacy rules and documented patient permission. The spouse's request alone may not authorize release. Authorization should come from the patient or legal authority. Relationship alone does not automatically grant full access to records. Question 25. An office review in a community health clinic shows that a tickler file is used in the office. Which purpose does it serve? Option A. Measure oxygen saturation. Option B. Draw blood into tubes. Option C. Track future follow-ups or reminders. Option D. Sterilize instruments. The correct answer is option C. Track future follow-ups or reminders. A tickler system helps staff remember time-sensitive tasks or future actions. Oxygen saturation requires a pulse oximeter. Blood collection uses phlebotomy supplies, not a reminder file. Sterilization requires approved equipment and process. Question 26. An office review in a specialty referral visit shows that a patient has chest hair that prevents electrodes from adhering. Which action is most appropriate? Option A. Prepare the skin according to protocol to improve electrode contact. Option B. Wet the electrodes with tap water only. Option C. Place electrodes over clothing. Option D. Ignore loose electrodes if the tracing prints. The correct answer is option A. Prepare the skin according to protocol to improve electrode contact. Good skin preparation helps electrodes adhere and improves tracing quality. Unapproved moisture does not replace proper skin preparation. Electrodes must contact skin to record electrical activity. Loose electrodes can create artifact and poor quality results. Question 27. A medical assistant is working in an outpatient laboratory when soap and water are required instead of alcohol sanitizer after caring for a patient with suspected Clostridioides difficile. Which reason explains this requirement? Option A. Hand washing is needed only before eating. Option B. Gloves completely replace hand hygiene. Option C. Soap and water help remove spores more effectively from the hands. Option D. Alcohol sanitizer is always illegal in clinics. The correct answer is option C. Soap and water help remove spores more effectively from the hands. Certain spores are not reliably eliminated by alcohol-based hand rubs, so mechanical washing is important. Hand hygiene is required at multiple points in patient care. Gloves reduce exposure but do not replace hand hygiene after removal. Alcohol-based hand rubs are appropriate for many routine situations. Question 28. Following office protocol in a diagnostic testing area, a reagent bottle is past its expiration date. Which action is appropriate? Option A. Do not use it for patient testing. Option B. Change the expiration date on the label. Option C. Mix it with a new reagent to strengthen it. Option D. Use it only for abnormal patients. The correct answer is option A. Do not use it for patient testing. Expired reagents can produce inaccurate results and should be handled according to policy. Altering dates is unsafe and unethical. Mixing reagents without approval can invalidate testing. Expired reagents are not reliable for any patient testing. Question 29. To protect safety in a quality control review, the office schedules several patients at the start of each hour and sees them as rooms open. Which scheduling method is being used? Option A. Prior authorization. Option B. Stream scheduling. Option C. Matrix blocking. Option D. Wave scheduling. The correct answer is option D. Wave scheduling. Wave scheduling brings patients in at set intervals such as the start of an hour. Prior authorization is payer approval and is not a scheduling method. Stream scheduling assigns patients specific individual appointment times. Matrix blocking reserves time unavailable for patient appointments. Question 30. At the start of care in a primary care office, a urine culture is ordered for a patient who can void independently. Which collection method is most appropriate? Option A. Random sample from an old urinal. Option B. First drops of urine into an unclean container. Option C. Clean catch midstream specimen. Option D. Specimen collected from the toilet bowl. The correct answer is option C. Clean catch midstream specimen. A clean catch midstream specimen helps reduce contamination from skin or genital flora. Old specimens may be contaminated and may not reflect current results. Initial urine can carry contaminants and an unclean container is inappropriate. Toilet water contaminates the specimen. Question 31. While working in a clinical skills review, the assistant is checking the electrocardiogram standardization mark. Which setting is commonly expected? Option A. 1 mm per millivolt. Option B. 100 mm per millivolt. Option C. 25 mm per millivolt. Option D. 10 mm per millivolt. The correct answer is option D. 10 mm per millivolt. Standard electrocardiogram calibration is commonly 10 mm per millivolt. That calibration would make complexes appear too small for standard interpretation. That value would greatly exaggerate waveform size. That value is not the common standard amplitude calibration. Question 32. A medical assistant is working in an outpatient laboratory when the term nephrology appears in a referral. Which specialty is involved? Option A. Bones. Option B. Ears. Option C. Kidneys. Option D. Eyes. The correct answer is option C. Kidneys. Nephrology is the specialty focused on kidney function and disease. Orthopedics focuses on the musculoskeletal system. Otolaryngology focuses on ear, nose, and throat conditions. Ophthalmology focuses on eyes. Question 33. When a patient encounter unfolds in a patient intake station, a capillary puncture is needed on an adult finger. Which side is generally preferred? Option A. The side of the middle or ring finger pad. Option B. The little finger near the bone. Option C. The tip of the index finger. Option D. The center of the thumb pad. The correct answer is option A. The side of the middle or ring finger pad. The lateral side of the middle or ring finger pad helps avoid bone and sensitive central tissue. The little finger has less tissue over bone and is usually avoided. The index finger is commonly used for touch and may be more sensitive or calloused. The thumb is often calloused and has a pulse, making it less preferred. Question 34. An office review in a same-day appointment shows that a patient says they feel chest pressure while the electrocardiogram is being prepared. Which action should the medical assistant take? Option A. Ask the patient to drive to another clinic. Option B. Notify the provider immediately and follow emergency protocol. Option C. Complete all paperwork before telling anyone. Option D. Tell the patient it is probably anxiety. The correct answer is option B. Notify the provider immediately and follow emergency protocol. Chest pressure may indicate a serious condition and requires prompt clinical attention. Potential cardiac symptoms should be handled through established emergency procedures. Administrative tasks should not delay reporting possible cardiac symptoms. Medical assistants should not diagnose the cause of chest pressure. Question 35. The care team in a busy front office asks for guidance because a subpoena for medical records arrives at the office. Which response is best? Option A. Immediately fax the entire chart without review. Option B. Give it to the provider or designated privacy officer for proper handling. Option C. Ignore it because subpoenas never apply to clinics. Option D. Ask the receptionist to summarize the chart from memory. The correct answer is option B. Give it to the provider or designated privacy officer for proper handling. Legal requests for records should be reviewed through office policy before information is released. Records should not be released without verifying legal requirements and scope. Subpoenas can require action and should not be ignored. Summaries from memory are unreliable and not an appropriate legal response. Question 36. To protect safety in a pediatric clinic, a patient asks for a copy of their medical record. Which action should the assistant take? Option A. Give the record to anyone who asks. Option B. Refuse because records belong only to the provider. Option C. Delete sensitive information before the request is reviewed. Option D. Follow the office release of information process. The correct answer is option D. Follow the office release of information process. Patients generally have rights to access their records, but the request must follow proper identity and release procedures. Identity and authorization must be verified before disclosure. Patients have rights to access their health information under applicable rules. Altering the record is inappropriate and may violate legal requirements. Question 37. Given the workflow in a patient intake station, a rapid strep test requires a throat swab. Which technique is best? Option A. Collect sputum from a deep cough. Option B. Swab the outside of the lips. Option C. Swab the tonsillar area and posterior pharynx while avoiding the tongue. Option D. Touch the tongue repeatedly to collect saliva. The correct answer is option C. Swab the tonsillar area and posterior pharynx while avoiding the tongue. A proper throat specimen contacts the likely infected area without contamination from the tongue or cheeks. Sputum is not the specimen used for a rapid strep throat swab. The lips do not provide the specimen needed for strep testing. Saliva and tongue contact can dilute or contaminate the specimen. Question 38. At the start of care in an administrative check-in area, a patient becomes angry about a long wait time. Which response is most appropriate? Option A. Acknowledge the frustration and provide a realistic update. Option B. Blame the provider in front of the patient. Option C. Ignore the patient until the appointment starts. Option D. Tell the patient to calm down or leave. The correct answer is option A. Acknowledge the frustration and provide a realistic update. Empathy and accurate information can de-escalate frustration while maintaining professionalism. Blaming coworkers is unprofessional and does not solve the issue. Ignoring frustration often makes the situation worse. Commands can escalate conflict and harm patient rapport. Question 39. In a patient intake station, a patient is placed lying flat on the back for an abdominal exam. Which position is being used? Option A. Prone. Option B. Fowler. Option C. Sims. Option D. Supine. The correct answer is option D. Supine. Supine means lying on the back facing upward. Prone means lying face down. Fowler position is seated or semi-seated. Sims position is side-lying with one knee flexed. Question 40. The care team in a family practice clinic asks for guidance because a patient is suspected of having tuberculosis. Which type of precautions is most appropriate? Option A. Airborne precautions. Option B. Droplet precautions only. Option C. Reverse isolation for staff protection only. Option D. Contact precautions only. The correct answer is option A. Airborne precautions. Tuberculosis can spread through airborne particles and requires airborne precautions with appropriate respiratory protection. Droplet precautions do not address smaller airborne particles that can remain suspended. Reverse isolation protects immunocompromised patients rather than controlling tuberculosis spread. Contact precautions focus on direct or indirect touch transmission and are not enough for tuberculosis. Question 41. The care team in an administrative check-in area asks for guidance because a mask becomes wet during patient care. Which action is appropriate? Option A. Dry it on the clean supply shelf. Option B. Replace the mask according to infection control practice. Option C. Keep wearing it for the rest of the week. Option D. Share it with a coworker. The correct answer is option B. Replace the mask according to infection control practice. A wet mask is less effective and should be changed safely. Used masks can contaminate clean areas. Extended use of a wet mask is not appropriate. Masks are not shared between staff. Question 42. Before the visit continues in a treatment room, muscle tremor artifact appears on an electrocardiogram tracing. Which intervention may improve the tracing? Option A. Remove all electrodes during the recording. Option B. Ask the patient to tense all muscles. Option C. Help the patient relax and support the limbs. Option D. Place the paper speed at 0. The correct answer is option C. Help the patient relax and support the limbs. Muscle tension and movement can create artifact, so comfort and support may improve tracing quality. Electrodes are required to capture the tracing. Tensing muscles increases electrical artifact. Paper movement is needed to record the waveform. Question 43. Following office protocol in a primary care office, a peak flow test is ordered. Which body system is being assessed? Option A. Skeletal system only. Option B. Integumentary system. Option C. Respiratory system. Option D. Urinary system. The correct answer is option C. Respiratory system. Peak flow measures how quickly air can be exhaled and is related to respiratory function. Peak flow does not measure bone structure. The integumentary system involves the skin, hair, and nails. The urinary system is assessed with urine tests and related procedures. Question 44. The care team in a specialty referral visit asks for guidance because a minor arrives without a parent for a non-urgent visit. Which action is best? Option A. Ask another patient in the waiting room to consent. Option B. Follow state law and office policy for consent requirements. Option C. Assume all minors can consent to every service. Option D. Refuse all care without considering exceptions. The correct answer is option B. Follow state law and office policy for consent requirements. Consent rules for minors vary by situation and jurisdiction, so policy must be followed. Other patients cannot provide consent for the minor. Minor consent is not universal for all services. Some laws allow minors to consent for certain services. Question 45. An office review in a primary care office shows that a venipuncture site is cleansed with alcohol before collection. Which action helps prevent hemolysis and discomfort? Option A. Draw blood while alcohol is still wet. Option B. Blow on the site to speed drying. Option C. Touch the vein again with an ungloved finger. Option D. Allow the alcohol to dry completely. The correct answer is option D. Allow the alcohol to dry completely. Letting alcohol dry reduces stinging and helps avoid contamination or hemolysis from wet alcohol. Wet alcohol can sting and may affect specimen quality. Blowing can contaminate the cleansed site. Palpating after cleaning can contaminate the site unless proper technique is used. Question 46. When a patient encounter unfolds in an administrative check-in area, the term hypertension appears in the problem list. Which meaning is correct? Option A. Joint inflammation. Option B. Slow breathing. Option C. Low blood glucose. Option D. High blood pressure. The correct answer is option D. High blood pressure. Hypertension means blood pressure above the normal range or treatment threshold identified by the provider. Joint inflammation is arthritis. Slow breathing is bradypnea. Low blood glucose is hypoglycemia. Question 47. Given the workflow in a phlebotomy station, a new patient calls to schedule an annual physical. Which information should be collected for registration? Option A. Demographics, contact information, insurance information, and reason for visit. Option B. Only the patient's favorite pharmacy color. Option C. Another patient's insurance card. Option D. The assistant's diagnosis before the visit. The correct answer is option A. demographics, contact information, insurance information, and reason for visit. Complete registration information supports scheduling, billing, and clinical preparation. That information does not complete registration. Insurance information must belong to the patient being registered. The assistant should not diagnose during scheduling. Question 48. In a preventive care visit, a mistake is found in an electronic progress note after it was signed. Which correction method is appropriate? Option A. Make an addendum according to office policy. Option B. Ask a coworker to change it under their login. Option C. Delete the original note completely. Option D. Ignore the error even if it affects care. The correct answer is option A. Make an addendum according to office policy. An addendum preserves the original entry while documenting the correction transparently. Using another person's login violates accountability. Deleting a signed record can destroy the audit trail. Clinically important errors should be corrected through proper procedures. Question 49. For a patient encounter in a medication administration visit, a disinfectant label lists a 10-minute wet contact time. Which action is necessary? Option A. Wipe the surface dry immediately. Option B. Dilute the solution more to reduce odor. Option C. Use the disinfectant only on clean hands. Option D. Keep the surface wet for the full listed contact time. The correct answer is option D. Keep the surface wet for the full listed contact time. Disinfectants need the manufacturer's required contact time to achieve the intended level of microbial kill. Removing the disinfectant too soon can make it ineffective. Unapproved dilution can reduce disinfectant strength. Environmental disinfectants are not hand hygiene products. Question 50. A medical assistant is working in a quality control review when a standard electrocardiogram is ordered for a patient with lotion on the chest. Which action improves electrode adhesion? Option A. Move all chest leads to the abdomen. Option B. Clean and dry the skin before applying electrodes. Option C. Apply electrodes directly over lotion. Option D. Use tape only and skip electrodes. The correct answer is option B. Clean and dry the skin before applying electrodes. Oil or lotion can prevent proper electrode contact and should be removed according to protocol. Incorrect lead placement changes the tracing and may impair interpretation. Poor adhesion can cause artifact or lead loss. Tape cannot record cardiac electrical activity. Question 51. After reviewing the situation in a same-day appointment, a claim requires the code for an office visit procedure or service. Which code set is used? Option A. Policy number. Option B. ICD-10-CM. Option C. Zip code. Option D. CPT. The correct answer is option D. CPT. CPT codes describe medical procedures and professional services. A policy number identifies insurance coverage and does not describe the service. ICD-10-CM codes describe diagnoses and reasons for services. A zip code identifies location and is not a procedure code. Question 52. In an administrative check-in area, a patient asks the medical assistant to interpret laboratory results. Which response is within scope? Option A. Post the result publicly so others can comment. Option B. Diagnose the patient based on abnormal values. Option C. Tell the patient the provider will review and explain the results. Option D. Change the results so it appears normal. The correct answer is option C. Tell the patient the provider will review and explain the results. Interpreting results and giving diagnostic meaning are provider responsibilities. Public disclosure violates confidentiality and professionalism. Diagnosis is outside the medical assistant's scope of practice. Changing results is unethical and falsifies the record. Question 53. At the start of care in an urgent care office, a patient needs crutch walking education after provider instruction. Which principle is important? Option A. The patient should skip follow-up if pain increases. Option B. Body weight should rest mainly on the armpits. Option C. Crutches should be used only on wet floors. Option D. Crutches should fit properly and not press into the axilla. The correct answer is option D. Crutches should fit properly and not press into the axilla. Improper crutch fit can compress nerves and blood vessels in the axilla. Worsening symptoms should be reported according to instructions. Weight should be supported through the hands, not the axilla. Crutches are mobility aids and wet floors increase fall risk. Question 54. Given the workflow in a telephone triage workflow, a patient has confirmed influenza and is coughing in the waiting room. Which infection control step is most appropriate? Option A, use only sterile gloves without a mask. Option B, apply droplet precautions and offer a mask according to protocol. Option C, place the patient beside an immunocompromised patient. Option D, skip precautions if the patient is already taking medication. The correct answer is option B. Apply droplet precautions and offer a mask according to protocol. Influenza is commonly managed with droplet precautions and source control measures. Sterile gloves do not protect mucous membranes from respiratory droplets. Separating symptomatic patients helps reduce transmission risk. Treatment does not remove the need for appropriate precautions. Question 55. During a specialty referral visit, an adult patient has a blood pressure reading much higher than previous visits. Which action should the medical assistant take? Option A, recheck using proper technique and report the finding according to protocol. Option B, erase the value because it may worry the patient. Option C, send the patient home to rest without notifying anyone. Option D, tell the patient that hypertension has been diagnosed. The correct answer is option A. Recheck using proper technique and report the finding according to protocol. Unexpected or significantly abnormal vital signs should be verified and communicated to the provider. Accurate documentation is required even when the value is abnormal. Abnormal readings require appropriate follow-up rather than dismissal. Medical assistants do not diagnose conditions based on one reading. Question 56. Given the workflow in a cardiology practice, a patient collapses in the hallway and is unresponsive. Which action should be taken first? Option A, activate emergency response and assess breathing according to training. Option B, offer water by mouth immediately. Option C, move the patient to a chair before assessing. Option D, finish documenting the previous visit. The correct answer is option A. Activate emergency response and assess breathing according to training. An unresponsive patient requires immediate emergency response and basic life support actions within training. Giving oral fluids to an unresponsive patient risks aspiration. Unnecessary movement can cause injury and delay assessment. Documentation should not delay emergency care. Question 57. To protect safety in a phlebotomy station, a sterile package is torn before a minor procedure. Which action is required? Option A, tape the wrapper and use the contents. Option B, spray the package with disinfectant. Option C, use the items if they look clean. Option D, consider the contents contaminated and obtain a new sterile package. The correct answer is option D. Consider the contents contaminated and obtain a new sterile package. A torn wrapper breaks the sterile barrier, so the contents cannot be considered sterile. Taping does not restore sterility after the barrier is compromised. Surface disinfectant cannot sterilize items inside a compromised package. Clean appearance does not prove sterility. Question 58. For a patient encounter in a preventive care visit, a complete blood count is ordered. Which tube is most commonly used? Option A, light blue tube with sodium citrate. Option B, lavender tube with EDTA. Option C, gray tube with fluoride oxalate. Option D, red tube with no anticoagulant. The correct answer is option B, lavender tube with EDTA. A complete blood count requires anticoagulated whole blood, and EDTA in a lavender tube preserves cell morphology. Sodium citrate is used mainly for coagulation studies. Gray tubes are used for tests such as glucose or lactate depending on protocol. A red tube allows clotting and is not the standard choice for a complete blood count. Question 59. While working in an administrative check-in area, a blood specimen must be mixed with additive after collection. Which technique is appropriate? Option A, gently invert the tube the required number of times. Option B, shake the tube forcefully. Option C, open the tube and stir with a swab. Option D, leave the tube unmixed until pickup. The correct answer is option A. Gently invert the tube the required number of times. Gentle inversion mixes blood with additive without causing unnecessary cell damage. Forceful shaking can cause hemolysis and inaccurate results. Opening the tube can contaminate the specimen and expose staph. Failure to mix may cause clotting or poor specimen quality. Question 60. While working in a quality control review, a pregnancy test performed in the office is classified as wave testing. Which requirement still applies? Option A. Report results before the test develops. Option B. Follow manufacturer instructions and quality control policy. Option C. Use expired kits if the package is unopened. Option D. Skip controls because waived means unregulated. The correct answer is option B. Follow manufacturer instructions and quality control policy. Waived tests are simple, but they still require correct procedure, controls, and documentation. Reading before the correct time can produce inaccurate results. Expired test kits may give unreliable results. Waived status does not eliminate quality responsibilities. Question 61. Before the visit continues in a procedure setup, lead V4 is being placed for a standard 12-lead electrocardiogram. Which location is correct? Option A. 5th intercostal space at the left midclavicular line. Option B. 4th intercostal space at the left sternal border. Option C. A midway between V2 and V4. Option D. A 4th intercostal space at the right sternal border. The correct answer is option A. 5th intercostal space at the left midclavicular line. V4 is placed at the 5th intercostal space along the left midclavicular line. That location is used for V2. That location is used for V3 rather than V4. That location is used for V1. Question 62. In a treatment room, the nervous system is being reviewed. Which structure carries impulses away from the cell body of a neuron? Option A. Axon. Option B. Platelet. Option C. Ureter. Option D. Alveolus. The correct answer is option A. Axon. An axon carries nerve impulses away from the neuron cell body. A platelet is a blood component involved in clotting. A ureter carries urine from kidney to bladder. An alveolus is a lung air sac. Question 63. At the start of care in a procedure setup, a pelvic examination is scheduled. Which patient position is commonly used? Option A. Sims. Option B. Prone. Option C. Trendelenburg. Option D. Lithotomy. The correct answer is option D. Lithotomy. The lithotomy position is commonly used for pelvic examinations. Sims position is often used for rectal procedures or enemas. Prone means lying face down and is not the common pelvic exam position. Trendelenburg places the head lower than the feet and is not the routine pelvic exam position. Question 64. For a patient encounter in a specialty referral visit, a patient requests an appointment reminder by text message. Which consideration is important? Option A. Post the reminder on social media. Option B. Text any diagnosis to any phone number in the chart. Option C. Ignore all reminder preferences. Option D. Follow office policy and patient communication preferences. The correct answer is option D. Follow office policy and patient communication preferences. Electronic reminders should follow privacy policy and documented preferences. Public posting would expose private information. Sensitive information and wrong numbers can create privacy risk. Preferences help guide appropriate communication. Question 65. At the start of care in a diagnostic testing area, the provider asks for body mass index during an adult wellness visit. Which values are needed? Option A. Pulse and respirations. Option B. Oxygen saturation and pain score. Option C. Blood pressure and temperature. Option D. Height and weight. The correct answer is option D. Height and weight. Body mass index is calculated from height and weight. Pulse and respirations are vital signs but are not used to calculate body mass index. Oxygen saturation and pain score provide different clinical information. Blood pressure and temperature do not determine body mass index. Question 66. A medical assistant is working in a patient intake station when a patient with diabetes is scheduled for fasting laboratory work. Which action is appropriate? Option A. Tell the patient fasting means no restrictions at all. Option B. Review fasting instructions and route medication questions to the provider. Option C. Tell the patient to stop all diabetes medications without provider input. Option D. Cancel the test because diabetes always prevents fasting labs. The correct answer is option B. Review fasting instructions and route medication questions to the provider. Fasting instructions can be reinforced, while medication adjustments require provider guidance. Fasting usually includes specific limits on food and drink. Medication changes can be unsafe without provider direction. Diabetes requires careful instructions but does not automatically cancel testing. Question 67. When a patient encounter unfolds in a treatment room, a coworker posts a patient's unusual injury story on social media without a name but with enough details to identify the patient. Which issue is most concerning? Option A, quality control testing. Option B, breach of confidentiality. Option C, appropriate marketing. Option D, routine scheduling. The correct answer is option B, breach of confidentiality. Identifiable health details can violate privacy even if the patient's name is omitted. Quality control relates to test system accuracy, not social media disclosure. Using patient information for entertainment or marketing requires strict authorization and is not appropriate here. Scheduling does not involve posting private health information publicly. Question 68. In a primary care office, a medical assistant performs a procedure without patient permission. Which legal concern may apply? Option A, coordination of benefits. Option B, defamation. Option C, emancipation. Option D, battery. The correct answer is option D, battery. Battery can involve intentional touching or treatment without consent. Coordination of benefits is an insurance concept. Defamation involves false statements that harm reputation. Emancipation relates to a minor's legal independence. Question 69. As part of exam preparation in a diagnostic testing area, a provider orders a medication using an abbreviation on the unsafe abbreviation list. Which action should the medical assistant take? Option A, clarify the order before proceeding. Option B, interpret the abbreviation however it seems most likely. Option C, ask another patient what the abbreviation means. Option D, ignore the medication order completely without communication. The correct answer is option A, clarify the order before proceeding. Unsafe or unclear medication orders must be clarified to prevent misinterpretation. Guessing can lead to serious medication errors. Patients are not appropriate sources for interpreting orders. The order should be clarified rather than silently ignored. Question 70. A medical assistant is working in a specialty referral visit when a patient says they cannot afford a prescribed medication. Which response is best? Option A, suggest sharing medication with a friend. Option B, tell the patient to stop all medications. Option C, ignore the comment because finances are private. Option D, notify the provider or appropriate staff so alternatives can be discussed. The correct answer is option D, notify the provider or appropriate staff so alternatives can be discussed. Cost concerns affect adherence and should be routed to the care team for appropriate options. Sharing prescriptions is unsafe and inappropriate. Stopping medication without provider guidance can be unsafe. The concern directly affects care and should be addressed respectfully. Question 71. At the start of care in a same-day appointment, a patient has been drinking hot coffee immediately before an oral temperature. Which action should the medical assistant take? Option A, record the temperature as normal without measuring it. Option B, wait according to office protocol before measuring the oral temperature. Option C, take the temperature immediately because oral readings are unaffected. Option D, switch to a rectal temperature without asking. The correct answer is option B, wait according to office protocol before measuring the oral temperature. Hot or cold intake can temporarily alter oral temperature and lead to an inaccurate reading. Vital signs must be measured rather than assumed. Recent liquids can affect oral temperature results. Changing to an invasive route requires proper indication and protocol. Question 72. While working in a walk-in clinic, a pain score is being collected during intake. Which approach is best? Option A, tell the patient pain is not part of vital signs. Option B, ask the patient to rate pain using the office's standard scale. Option C, change the score to match the assistant's opinion. Option D, assume pain level from facial expression only. The correct answer is option B, ask the patient to rate pain using the office's standard scale. Using a consistent pain scale helps document subjective pain in a comparable way. Pain assessment is commonly included in intake workflows. The pain score should reflect the patient's report. Facial expression alone may not reflect the patient's reported pain. Question 73. As part of exam preparation in a medical office workflow, the prefix hyper appears in a term such as hyperglycemia. Which meaning is correct? Option A, around. Option B, below normal. Option C, between. Option D, above normal or excessive. The correct answer is option D, above normal or excessive. Hyper means excessive or above normal, as in high blood glucose. Around is indicated by peri. Below normal is indicated by hypo. Between is indicated by inter. Question 74. The care team in a medical office workflow asks for guidance because a specimen label is missing after collection. Which action is best? Option A, send the tube with no label and explain later. Option B, follow facility policy for recollection or correction without guessing. Option C, ask another patient if the tube belongs to them. Option D, write a name on the tube from memory. The correct answer is option B, follow facility policy for recollection or correction without guessing. Unlabeled specimens create patient identification risk and must be managed according to policy. Laboratories commonly reject unlabeled specimens. Patients cannot resolve specimen identity errors reliably. Guessing can cause a serious misidentification error. Question 75. After reviewing the situation in a women's health clinic, the provider mentions the largest artery in the body. Which vessel is being described? Option A, aorta. Option B, carotid vein. Option C, vena cava. Option D, pulmonary vein. The correct answer is option A, aorta. The aorta is the main artery carrying blood from the left ventricle to systemic circulation. Carotid structures are in the neck, but the carotid artery is not the largest artery. The vena cava is a large vein returning blood to the heart. Pulmonary veins return blood from the lungs to the heart. Question 76. To protect safety in a cardiology practice, a wet floor is noticed near the reception desk. Which action best prevents injury? Option A, wait until a patient reports slipping. Option B, ignore it because it is not in an exam room. Option C, cover it with loose papers. Option D, place a warning sign and arrange cleanup immediately. The correct answer is option D, place a warning sign and arrange cleanup immediately. Prompt warning and cleanup reduce slip and fall risk. Prevention should occur before an injury happens. Safety hazards matter throughout the facility. Loose paper can worsen slipping and does not clean the hazard. Question 77. Following office protocol in a specialty referral visit, a 12-lead electrocardiogram shows wandering baseline artifact. Which cause is most likely? Option A, poor electrode contact or patient movement. Option B, correct limb lead placement. Option C, a normal calibration mark only. Option D, a properly grounded machine with still patient. The correct answer is option A, poor electrode contact or patient movement. Wandering baseline is commonly caused by motion, loose electrodes, or poor skin contact. Correct placement should reduce rather than create artifact. Calibration marks do not explain baseline movement during tracing. Good grounding and stillness reduce electrical or motion artifact. Question 78. While working in a procedure setup, the prefix hypo appears in a term such as hypoglycemia. Which meaning is correct? Option A, below normal or deficient. Option B, above normal. Option C, before. Option D, against. The correct answer is option A, below normal or deficient. Hypo means below normal or deficient, as in low blood glucose. Above normal is indicated by hyper. Before is indicated by pre. Against is indicated by anti. Question 79. For a patient encounter in a medical office workflow, a patient has a minor nosebleed while waiting. Which first aid instruction is commonly appropriate? Option A, pack the nose with contaminated gauze. Option B, tilt the head far backward. Option C, lie flat immediately without assessment. Option D, sit upright and lean slightly forward. The correct answer is option D, sit upright and lean slightly forward. Leaning forward helps reduce swallowing blood while upright posture can reduce pressure. Contaminated materials should not be inserted into the nose. Tilting backward can cause blood to drain into the throat. Lying flat can increase swallowing of blood and is not the usual first step for a simple nosebleed. Question 80. Given the workflow in a quality control review, an insurance plan requires approval before a specialist visit. Which process is being described? Option A, autoclaving. Option B, prior authorization or referral process. Option C, venipuncture. Option D, auscultation. The correct answer is option B, Prior authorization or referral process. Some plans require authorization or referral before certain services are covered. Autoclaving sterilizes instruments and is unrelated to payer approval. Venipuncture is blood collection and does not authorize insurance coverage. Auscultation is listening to body sounds and does not approve visits. Question 81. Following office protocol in a medical office workflow, a chemistry panel requiring plasma is ordered and the facility uses heparin tubes. Which tube color is commonly associated? Option A, light blue tube. Option B, green tube. Option C, lavender tube. Option D, gray tube. The correct answer is option B, green tube. Green tubes commonly contain heparin and are used for certain plasma chemistry tests. Light blue citrate is used for coagulation testing. Lavender EDTA is typically used for hematology testing. Gray tubes are often used for glucose-related testing depending on protocol. Question 82. In a preventive care visit, a patient has an advance directive in the chart. Which statement is most accurate? Option A. It communicates the patient's wishes about future medical care. Option B. It is used only to schedule appointments. Option C. It allows the assistant to ignore provider orders. Option D. It replaces all insurance forms. The correct answer is option A. It communicates the patient's wishes about future medical care. An advance directive helps guide care decisions if the patient cannot speak for themselves. Scheduling is unrelated to the purpose of an advance directive. Care decisions still follow legal, clinical, and facility processes. Advance directives do not replace billing or insurance documents. Question 83. At the start of care in an exam room, a patient asks the assistant whether to stop taking a prescribed medication. Which response is appropriate? Option A. Refer the question to the provider. Option B. Recommend doubling the dose instead. Option C. Suggest using a friend's medication. Option D. Tell the patient to stop immediately. The correct answer is option A. Refer the question to the provider. Medication changes require provider guidance because stopping therapy can be unsafe. Changing a dose without provider order is unsafe and outside scope. Sharing medication is unsafe and inappropriate. Directing medication discontinuation is outside the assistant role. Question 84. Given the workflow in an exam room, the term cardiology appears in a referral. Which specialty is involved? Option A. Digestive disorders. Option B. Skin disorders. Option C. Heart and cardiovascular system. Option D. Kidney disorders. The correct answer is option C. Heart and cardiovascular system. Cardiology focuses on the heart and cardiovascular system. Gastroenterology focuses on the digestive system. Dermatology focuses on the skin. Nephrology focuses on the kidneys. Question 85. An office review in a family practice clinic shows that the provider discusses the function of white blood cells. Which role is most accurate? Option A. Store bile for digestion. Option B. Carry oxygen as their primary job. Option C. Produce insulin in the pancreas. Option D. Help defend against infection. The correct answer is option D. Help defend against infection. White blood cells are immune cells that help protect the body from infection. Bile storage is a gallbladder function. Oxygen transport is mainly the role of red blood cells. Insulin production occurs in pancreatic beta cells, not white blood cells. Question 86. Given the workflow in a same-day appointment, a voicemail must be left for a patient according to office policy. Which message is safest? Option A. Leave limited information and a callback number. Option B. Leave another patient's results for comparison. Option C. Describe the diagnosis in detail on the message. Option D. Demand payment details with full medical history. The correct answer is option A. Leave limited information and a callback number. Limited voicemail content reduces the risk of exposing health information to others. Sharing another patient's information is a privacy breach. Detailed clinical information may be heard by unauthorized people. Excessive information violates privacy and may not be necessary. Question 87. An office review in a community health clinic shows that the provider is running behind and a patient asks for an update. Which response is professional? Option A. Tell the patient that waiting is their only option. Option B. Discuss another patient's emergency as the reason. Option C. Apologize for the delay and provide the best available estimate. Option D, guarantee an exact time even when it is unknown. The correct answer is option C, apologize for the delay and provide the best available estimate. Clear and courteous updates help manage expectations without blaming others. Dismissive communication is unprofessional. Sharing another patient's situation can violate privacy. False certainty can create more frustration. Question 88. After reviewing the situation in a patient intake station, a 24-hour urine collection begins at 8 a.m. Which instruction is correct? Option A, leave the container unrefrigerated unless it smells unusual. Option B, keep only the first void and discard the rest. Option C, discard the first void and collect all urine for the next 24 hours. Option D, collect urine only when symptoms occur. The correct answer is option C, discard the first void and collect all urine for the next 24 hours. Discarding the first void establishes the start time, and all urine afterward is collected until the end time. Storage requirements should follow the test protocol and preservative instructions. A single first void is not a 24-hour collection. Timed urine testing requires all urine during the collection period. Question 89. When a patient encounter unfolds in an outpatient laboratory, a medication order is present but the patient reports an allergy to the drug. Which action should occur before administration? Option A, change the medication to another drug independently. Option B, administer the medication because it was ordered. Option C, ask the patient to sign a form and give it anyway. Option D, hold the medication and notify the provider. The correct answer is option D, hold the medication and notify the provider. A reported allergy is a safety concern that must be clarified before giving the medication. Medical assistants do not independently substitute medications. An order does not override a possible allergy. A form does not make an unsafe medication appropriate. Question 90. While working in a women's health clinic, a used needle must be discarded after an injection. Which practice is safest? Option A, carry the needle to the front desk for disposal. Option B, recap the needle with both hands. Option C, activate the safety device and place the needle in a sharps container. Option D, place the needle in regular trash. The correct answer is option C, activate the safety device and place the needle in a sharps container. Sharps should be secured and discarded immediately in a puncture-resistant sharps container. Transporting exposed sharps through the office increases risk. Two-handed recapping increases needle stick risk. Sharps can injure staff and must not go into regular trash. Question 91. As part of exam preparation in a medical office workflow, a pulse oximeter is placed on a cold finger and the reading is inconsistent. Which action should be tried first? Option A, increase oxygen without reporting the finding. Option B, ignore the waveform and record the lowest value. Option C, warm the finger or choose a better perfused site. Option D, place the probe over wet nail polish. The correct answer is option C, warm the finger or choose a better perfused site. Poor peripheral perfusion can make pulse oximetry readings unreliable. Medication or oxygen changes should follow provider direction and clinical protocol. An unstable signal should be corrected before documenting the value. Moisture and polish can interfere with sensor performance. Question 92. While working in a quality control review, a staff member shares an electronic health record password to save time. Which risk is created? Option A, loss of accountability for chart access. Option B, automatic insurance approval. Option C, better sterilization monitoring. Option D, improved privacy protection. The correct answer is option A, loss of accountability for chart access. Unique logins support audit trails and show who accessed or changed information. Passwords do not control payer authorization. Login credentials do not sterilize instruments. Password sharing weakens privacy and security. Question 93. When a patient encounter unfolds in a cardiology practice, an intradermal test is being prepared. Which description matches the route? Option A, injection into deep muscle tissue. Option B, medication swallowed by mouth. Option C, medication placed into the ear canal. Option D, injection just under the epidermis to form a small wheal. The correct answer is option D, injection just under the epidermis to form a small wheal. Intradermal injections are shallow and often create a small bleb or wheal. Deep muscle injection is intramuscular. Swallowed medication is oral administration. Ear canal administration is otic. Question 94. During a women's health clinic, the provider asks for the chief complaint before entering the room. Which documentation is most appropriate? Option A, ear infection diagnosed today. Option B, patient reports sharp right ear pain for 2 days. Option C, patient seems dramatic about ear pain. Option D, right ear normal after exam. The correct answer is option B. Patient reports sharp right ear pain for 2 days. The chief complaint should be documented as the patient's main reason for the visit in clear, concise wording. A diagnosis should not be documented by the assistant unless the provider has made it. Subjective judgment is unprofessional and not appropriate for the medical record. Exam findings belong to the provider and are not the chief complaint. Question 95. Before the visit continues in a patient intake station, a sterile dressing change is being prepared. Which action helps maintain sterility? Option A, place sterile gauze on an unclean counter. Option B, open sterile supplies without touching the inner sterile surface. Option C, reuse sterile gloves from a previous patient. Option D, reach across the field with unsterile clothing. The correct answer is option B. Open sterile supplies without touching the inner sterile surface. Avoiding contact with sterile surfaces helps preserve the sterile field. An unclean surface contaminates sterile supplies. Sterile gloves are single-use and patient-specific. Reaching over the field can contaminate it. Question 96. In a phlebotomy station, the QRS complex is reviewed on an electrocardiogram. Which event does it mainly represent? Option A, lung gas exchange. Option B, ventricular depolarization. Option C, ventricular filling with blood only. Option D, atrial repolarization only as the visible main event. The correct answer is option B, ventricular depolarization. The QRS complex represents electrical activation of the ventricles. Gas exchange occurs in the alveoli, not on the QRS waveform. Mechanical filling is not the primary electrical event represented by QRS. Atrial repolarization is usually hidden within the QRS complex. Question 97. Given the workflow in a quality control review, a patient calls with chest pain and shortness of breath. Which scheduling action is most appropriate? Option A, tell the patient to send an email later. Option B, schedule the patient for next month. Option C, follow emergency triage protocol immediately. Option D, give a diagnosis over the phone. The correct answer is option C, follow emergency triage protocol immediately. Potential emergency symptoms should be handled urgently according to office protocol rather than scheduled as routine. Potential emergencies require immediate action. Routine scheduling can delay care for potentially serious symptoms. Medical assistants should not diagnose the cause of symptoms. Question 98. A medical assistant is working in a family practice clinic when the endocrine system is being reviewed. Which gland produces thyroid hormone? Option A, appendix. Option B, thyroid gland. Option C, urinary bladder. Option D, gallbladder. The correct answer is option B, thyroid gland. The thyroid gland produces hormones that help regulate metabolism. The appendix does not produce thyroid hormone. The urinary bladder stores urine and does not produce thyroid hormone. The gallbladder stores bile and is not an endocrine gland producing thyroid hormone. Question 99. An office review in an internal medicine office shows that a patient receives a document explaining what the insurer paid and what may be owed. Which document is this? Option A, advance directive. Option B, sterilization log. Option C, progress note. Option D, explanation of benefits. The correct answer is option D, explanation of benefits. An explanation of benefits summarizes payer processing, allowed amounts, payments, and patient responsibility. An advance directive communicates future care wishes, not payment information. A sterilization log tracks instrument processing, not claim payment. A progress note documents clinical care, not insurance payment decisions. Question 100. When a patient encounter unfolds in a cardiology practice, the provider requests an adult radial pulse during intake. Which technique should the medical assistant use? Option A, use the thumb to feel the pulse. Option B, place 2 or 3 fingers over the radial artery at the wrist. Option C, place the stethoscope over the abdomen. Option D, count respirations before locating the pulse. The correct answer is option B. Place 2 or 3 fingers over the radial artery at the wrist. The radial artery at the thumb side of the wrist is commonly used for an adult pulse. The thumb has its own pulse and can interfere with accurate counting. The abdomen is not used for a routine radial pulse. Respirations are measured separately and do not identify the pulse site.